Hi, thank you for watching our video today. We are going to tab the HickPicks book for the certification exam. So many videos focus on tabbing of the CPT book and the ICD-10 book, but tabbing of the HickPicks book is very helpful too. And so we're going to get into that. And if you haven't subscribed to our YouTube channel yet, please do, because we upload videos all the time. So just to make sure that we are clear, our HickPicks book, it's pronounced HickPicks, but it's spelled HCPCS. So we're going to be tabbing the AAPC HickPicks today, but you might have another manual, and that's okay too. It's still, the layout is generally the same. AAPC HickPicks have some pretty awesome tools in it, so I personally prefer it, but you can follow along no matter what manual you're using. So we'll go ahead and get started. Okay, so to tab our HickPicks Level 2 Expert Coding Book for 2017, before we get started, just keep in mind for the AAPC certification exam, there are going to be only 5 questions on the HickPicks section. These questions can cover modifiers, supplies, medications, professional services for Medicare patients, but compared to the other coding books, there aren't very many questions on HickPicks. So keep that in mind. HickPicks, it's pronounced HickPicks, but it stands for Healthcare Common Procedure Coding. And it helps code procedures and equipment, and it was created by CMS. So those are just some quick tips. We're not going to spend too much time tabbing this book because, like I said, there's only 5 questions on the exam, and it's pretty straightforward what we need to tab, right? So let's get started. Here's our book. Okay, so one of my favorite things about the HickPicks book, it probably is my favorite thing, is that it offers this modifier cheat sheet. And it's, pretty substantial. It covers the modifiers that are specifically for HickPicks codes, as well as our CPT modifiers. So I really like that. And, if you see a modifier and it looks a little funny, chances are it's a HickPicks modifier. So you see that it can be alphanumeric, and that's what the difference is between CPT modifiers and HickPicks modifiers. Just at first glances, HickPicks modifiers can be alphanumeric, while CPT modifiers are numeric, right? Except for the anesthesia modifier. So that's different, but we can just make sure that you know this, you're aware of it, and you just get familiar with it. Like I always say, get familiar with your coding books. Best thing for you. Best thing you can do for yourself for passing the certification exam is really know your books. So HickPicks Level 2 codes, they're 5 characters long. Each code starts with a letter. It's followed by 4 numbers. It's grouped by like procedures, services, and equipment. And the letter really denotes what grouping the codes are in. So that's what the letter denotes. So for example, and I'll just start here, probably the most important thing you're going to tab, at least in my opinion, is the table of contents. Because the table of contents is really going to eliminate us having to tab every section, right? Because this is really all you need to know where this is at, and you can get anywhere you need to be. So the first thing I would do is definitely tab my table of contents. And if you've watched my other videos, you know that you have to use plastic tabs. You can't use paper tabs. They aren't allowed for the exam. I prefer these sturdy plastic tabs. I use both the little ones and these big ones when I tab my different coding books. But make sure that you're not using paper tabs because they're not allowed. And it's just easier if they're sturdy because you're going to be flipping through your books, probably your whole coding career. So, table of contents. And it really just, lets us know exactly, like I said, where everything is. So instead of tabbing each individual chapter and each individual appendix. If you know where your table of contents is, you can easily get there. And I know that might seem pretty self-explanatory, or it's the table of contents, it's right at the beginning. But when you're taking the exam, you know, it might be a high pressure environment for you. And so it's just easier to know exactly, without a shadow of a doubt, that you have it tabbed and you can just look at it quickly and get there. So table of contents is my favorite. I'll just cover a couple other things for you. So like the introduction, right? You don't need to tab this, but why is it important? If you can't remember what the abbreviation stands for, it's listed right here, right? So that's why it's important. It also tells you, you know, who developed this book, CMS, what it has in it, different features. So it's just, you know, just make sure, like I say, know your books, because if you don't remember what the abbreviation stands for and it happens to be one of your exam questions, you can just flip over here and verify that what you think is right is truly right. Like all our coding books, we have simple symbols and conventions. And like I said, I don't necessarily think you have to tab that for this book. I tab it in the ICD-10 and I tab it in the CPT book. But for the HickPicks book, just know where it's at, you know, and know the table of contents can get you here really quick. So just know that symbols and conventions is here too. And they have the instructions for using this manual as well. HickPicks coding procedures. This is something that I really like too, actually, just to kind of read through it. I know it's pretty wordy, but it's important, and it really tells you the different types of codes that are in your HickPicks book. So this is a good thing to read through and highlight different things you might think are important. It really just tells us the different types of codes for the level 2 HickPicks. For example, permanent national codes, dental codes, miscellaneous codes. So just get familiar with it. It's good just to read through your book at least once, and you know, maybe underline or highlight things that jump out at you. And then we're just gonna, your table of contents will get you here new and revised codes for 2017. I don't think that that's important enough to tab, along with deleted codes crosswalk. No. G codes to CPT codes crosswalk. I tab this, and I tab it because in my jobs in my coding profession, my last 3 jobs I've used G codes and CPT codes, and I like this. I like that it tells me what G code can crosswalk to the different CPT codes. I really like this section. So if you get into any kind of, you know, risk adjustment coding, or you're coding Medicare patients, you know, this is something that you might use on a regular basis. So G codes are also some of the most common HickPicks codes. So this is just something that's helpful for me to know, to understand, and I tab it my G codes crosswalk. And it's pretty big, so it goes all the way back here. The next thing I think is important for a tab is our anatomical illustrations. I love this. I love that it includes these in this book. There's quite a few of them. And so if anatomy might not be your strong suit, know what diagrams you have, what anatomical illustrations you have in your HickPicks book in case a question comes up on it. If it asks you, you know, can you tell me the different parts of the large intestines? Well, you have a diagram here that thankfully shows it to you, and it actually shows you like the order too. And so that's really helpful for me. And as you can see, there's all different kinds. It's definitely helpful. So I tab my anatomical illustrations. And then the next big important tab for me is our index. This is how you're looking up codes, right? I actually put the index tab at the top. So if I'm looking up a code That's how I can just go straight to my index using my tab. It's really just to save me time for the test taking environment. So, you know, HickPicks, your HickPicks book is full of all different kinds of codes, right? So we have like our A codes, and I don't tab these because I use the table of contents. And this is the only book that I don't over tab, because really, you know, I think that the table of contents can get you there. But A codes, they have like 3 different sections: transportation, medical and surgical supplies, miscellaneous and experimental. So we see our transportation right here, right at the beginning, medical and surgical. And then at the end, we have administrative, miscellaneous, and investigational. And then our B codes would be next. And like I said, I don't tab these. It's good just to know, you know, where they are and how to find them. But you see how small the B code section is. This is our enteral and parenteral therapy. C codes are next. C codes, you'll hear these referred to as OPS because it's outpatient PPS, right? So outpatient prospective payment system. And so what I do though here, because I've noticed that I've taken quite a few exams for my different credentials, but the outpatient PPS, these can often be referred to as OPS, right? So instead of just tabbing it, spelling it out, I'll just put OPS. And so this is just a little flag to me that my C codes are my OPS codes, my outpatient prospective payment system. And these are temporary hospital outpatient codes. So that's just a little trick there. I recommend it. Again, like I said, I don't see the need to really tab every section. You'll know where it is from your table of contents. So your other big section is your durable medical equipment section. So depending on the type of brace that you have, or you know, any type of medical equipment that you're using, a crutch, what type of crutch you're using, a walker, this will be where you will find the code to capture that medical equipment code. And so again, instead of just, I just give myself a little flag here. These are my DME, durable medical equipment codes. And we can just go on. As if you didn't catch it, we don't have D codes in here. D codes are dental codes. They are considered HickPicks codes, but for the purposes of our coding exam, we don't need to know those unless we're doing dental coding, right? G codes, my favorite. Temporary procedures and professional services. So G codes, I don't even tab it, but you know, it's something that we use often. I did tab that G codes crosswalk. So it's just important that you know how to get to the different sections in your HickPicks book. Like I said, the speed is like your #1 factor for your exam. You can't spend too long on questions. You have to, you know, get through them as fast as you can, but while, you know, understanding the question. So that's the trick, because you think 5 hours and 40 minutes will just give you enough time, but it flies by. It flies by for sure. So, you know, there are different codes for each type of procedure, professional service, each type of brace, and also for your drug codes. Another big section in the HickPicks books. And my second favorite. Well, first, the H is our H codes are our rehabilitation services. So these are H codes, but my next big favorite is drug codes. And I don't know why they're my favorites. They drive some people crazy. But our drug codes, drugs administered other than oral method and chemotherapy drugs. So you might have like a shot of Kenalog, right? And depending on the dosage, you'll find that drug code in here in your J codes. And then, depending on what the dosage is, you might have a J code ×2, or just a J code if it's only, one dose. So you have to pay attention to things like the milligrams and the dosing. And your questions, definitely pay attention to those. So I do label my J codes. I just put drugs. And the beginning of our J codes is just our drugs administered other than oral method, but then we have our chemo drugs too. And our chemo drugs are still J codes. We have our L codes, our orthotic and prosthetic services. That's this pink section. So you can see here that any prosthetic or any orthotic device, this is where you would capture that, and like a knee brace, right? Okay. Again, I'm not going to tab it. I only tab certain sections, but you might find that you prefer to tab every section, and that's perfectly okay too. So L, we're still in prosthetic. L is a big section. Now we're at our P codes, pathology and laboratory. Right, so we have that here. It's just a short little section. Our Q codes, temporary codes. R codes, you would just fly right past it if you didn't see it. It's just our R codes are diagnostic radiology services. And then we have our S codes, which are private payer codes. Payers, you think of payers as, insurance companies are payers. Our T codes, state Medicaid agency codes. So anytime you see a T code, it's a state agency code. And then we have our V codes. Our V codes are our vision and hearing. And so right after that, we get into our appendix. So our appendix A, like I said, I don't tab everything because the table of contents can get you right there. But there's some great tools in our appendix, our appendixes. So this is just, it gives us the different drug names, and dosing, and the route that you can get them, and then the code. So it's really like a cheat sheet. One thing I really like about this is that it gives you these little abbreviations here. So intravenous administration, intramuscular administration, intra-arterial administration. These are important because you'll see that in documentation. You'll see it documented, the type of method the drug was administered through. So there's all kinds of appendix. Make sure that you just look through them. You know where they are. You know how to find them using your table of contents. That's like the biggest thing, is just knowing your books inside and outside, right? We have some more modifiers on the back here. Again, I love that the HickPicks book gives all the modifiers. CPT gives like a quick snapshot. HickPicks gives almost all of them. We have our anesthesia modifiers. So remember, these are what I was talking about, the alphanumeric ones that do fall in the CPT book, but all the other ones are alphanumeric are HickPicks modifiers. So make sure that you're familiar with this. You can look through this. It's a great tool when you have questions with modifiers come up. And that's it. I mean, reach out to us if you have any questions. You can always email. You can email me at instructor@thecodingspot.com. So it's just instructor@thecodingspot.com. You can visit the website, thecodingspot.com. We have a Twitter at The Coding Spot and our YouTube channel, of course. Subscribe to it. And if you have any questions about anything or you're struggling with any type of coding and it's something that we might be able to help you with, just reach out to us. We'd love to help any way we can. We love coding. Coding is, our life here at The Coding Spot. So please let us know if you have any questions or if there's any videos you might like to see.